symptoms, archetypes, psychosis. What's the common element of those three things? The answer might surprise you. In this conversation with Steve and Pauline Richards of the IPSA, we delve into that question, and we're going to see how, no surprise, this stuff actually applies to you. So sit back and enjoy. The link. So we figured it out.
We did.
Great to see you again, Dr.
It is.
Yeah, a long time no see.
It's been a while, yes.
It has. It has. What's new on your side of the world?
Ooh,
Gosh.
a lot really, I guess. On the professional side, I suppose, which is something. We're working hard on that. I'm pretty much fully booked up to the end of the month with professional meetings, so that's a good thing.
Wow, that is great.
Yeah, and I'm working on that revised collective works one, the informational monism and superposition theory, and that should be about 500 A4 pages when I've done with this.
Yeah, I bet.
And I've got something to do for Mark as well, Mark Solms. It's only a bulletin report, which will cover a little bit on meta instincts and archetypes. So that should be interesting.
Yeah, it does sound interesting. I'm doing inpatient work now.
Yeah, must be very demanding now.
It is. It's a very different world.
Yeah.
Yeah, I see much sicker folks, but the rules of the psyche are still kind of the same. So I guess I'm just kind of seeing that from this point of view now, than more so than I was before. Yeah.
We've been very much enjoying your channel and what you did for the Essex group of psychoanalysts, I think, or whatever they're called. Yeah, that mind to mind body thing, that was really interesting.
Yeah. So I should be able to do some more of those in the future. I think they're wanting me to do something in April. I haven't figured out what I'm going to talk on yet, but I'll find something to talk about.
Oh, good. People look forward to that very much.
Yeah. So I guess we were talking about psychosis and like how does that play into our model development? And I am curious to see what your thoughts are on this. In that the way that I've been able to kind of organize symptom presentation across the spectrum of, on one end, in outpatient world, you see mostly depression, anxiety, OCD sometimes, that kind of thing. In the inpatient world, you see more severe stuff like schizophrenia, bipolar disorder. Outside of the substance, spectrum, there's plenty of that, of course, too. But what's the organizing theory behind it, right? That's the question that I'm always asking myself every day. I'm asking that, trying to figure out why did they present this way versus that way? What's actually going on? So the theory that I've kind of been working on, it's not really mine. It's kind of an amalgamation of things I've learned over the years, drawing from Jung, drawing from Pierre Genet, Anthony Stevens, of course, all those guys. And I think what's the underlying issue with most psychotic disorders is that they have a difficulty integrating information. It's faulty integration of information. So when you present with paranoia, for example, the paranoia itself is secondary to the main problem. So it's oftentimes in psychiatry, if we get really locked into the DSM mode of thinking, we only look at symptoms and then just sort of list them off, and then we say we give this medication for this symptom, and out pops the black box if they get better with this pill. But that's never good enough for me. And to be fair, not everybody thinks that way, but that's just kind of how it is. But I'm looking at this and I'm trying to figure out what's the underlying problem. And I think if your ability to integrate information is faulty, then you're going to come up with responses that make sense given what you are presented. And the problem is that the presentation to you is faulty. The response, if my integration is screwed up and I presented a world in which I can't trust anyone and I'm being monitored and poisons are being injected into the atmosphere, it makes sense for me to respond in a paranoid manner. So those natural fear instincts that we have that are much more ancient than the information integration stuff which goes on up here in the frontal lobe and the parietal and temporal lobes.
Yeah.
Those are the things that are screwed up, and they give us a faulty picture of the world. Does that make sense?
Oh yeah,
yes.
perfectly. Yeah.
Yeah.
Absolutely.
But what I wanted to know from your angle with the hypnosis is, and I've got some other questions about this too that I wanted to get to, but it's how do you guys, I guess maybe you probably don't deal with psychosis very much from your side. Okay. And I wasn't sure if you had a way of viewing that or understanding it, or if that's something you don't look at much, or what's your perspective there?
Yes, to the second part, no to the first. I mean, obviously Pauline's worked in psychiatry, acute and chronic. She's done quite a bit over the years. I've had limited experience of that. We get people presenting sometimes who are prodromally psychotic, and it's clear that they are. And our strategy with that is to ensure that their safety comes first and they get the right medical support. That has to happen. But with respect to a model of it, yes, we have to have that. And I think particularly as we're of fundamentally a Jungian psychodynamic orientation, then it's inevitable that you have to make some kind of statements of understanding about what's presenting. The hypnosis element, we would never use hypnosis with someone who certainly
not knowingly,
Mm.
who was floridly psychotic, or even with.
So why is that? I have my own ideas of why you wouldn't, but I want to hear from the experts.
Thank you. I wouldn't, and I'm sure Pauline would be the same, because we don't have sufficient control over the environment of that patient and over their life. And if we did have, that would be different, provided there was a team to back us up. There was a psychiatrist, obviously, like yourself, which would be a gift.
It would, yeah. Yeah.
They're rare.
They are rare.
Well, you know what I mean? They're rarer even than that.
Yeah.
So we would need that, and it would have to be very carefully managed. The reason being is because the effects of trance states, which are dissociative in and of themselves, can reinforce things that shouldn't be reinforced, and can bring into association to the normal ego personality things which would be under such a head of pressure that they would persist. And that would be the last thing that we would want to do. So we try to be as careful as possible never to do that with someone who's presenting in that way.
So one way I look at psychosis is, I noticed even as a resident that it impairs memory. Psychosis impairs memory, and I noticed this because I would talk to my patients who were floridly psychotic when they came in, and then medications got them better, and then I would ask them about when they first came in, and they more often than not, much more often than not, would say they don't really remember it that well. It's kind of hazy, or they might even say that it didn't happen, and I was fine. They'll come up with some kind of post hoc explanation for why they went into the hospital when they were like sometimes literally bouncing off the walls. But then with treatment, they are much more clear, but it's only clear now. And so their autobiographical narrative of that part is a big blank, And so, of course, as we know, memory is largely imagination. And so they'll construct something that more or less makes sense and go from there. So then I looked at that and I think, so psychosis then is a disorder of the ego. In a sense, it's an extremely fragile state of the ego, or fragmented, whatever the word is, busted up, state of the ego. So that's kind of what I was thinking when you're talking about the hypnosis, and in the sense that a hypnotic state purposefully puts you in an ego reduced, I guess, state, or more dissociative, whatever.
Yeah.
So in a psychotic state, you don't want that because they're already barely holding it together as it is,
Yeah.
if at all.
Yeah.
And so all that would do is just shatter them even more.
Yeah.
Yeah.
Absolutely. And if that the memory, if it's state bound, then obviously you don't want to use a technique like hypnosis that might then put that person in a situation where you recreate the conditions that brought about the psychosis in the first place. So it may be not so much that what's happened to that person is lost from memory completely, but it's locked into a particular informational state that might be reconfigured if you then use something like hypnosis. So that's another reason why we're very careful. But just to come back to the point that was made earlier about having a team of like-minded people, I mean, that's almost a kind of a dream team in a way, because as with lots of things in medicine, if you have a group of like-minded people who all have slightly different skill sets, you could see how something like that could be managed very carefully and maybe even, be very effective. But as Steve was saying, because we tend not to have that medical support, even though we value it, we have to approach things very carefully. I mean, the last thing that you want to do is to create or recreate a situation like that for someone.
Yeah, that makes sense. So if I were to then take a look at the effect of psychosis and how it affects memory and how that ties into ego strength, the way that I make sense of that, along with the other sense of other symptoms, would be to view the psyche or the brain or the mind, whatever you want to call it, as, and I've talked about this before elsewhere, about how I think it's basically a meaning-making organ. Like the whole purpose of it is to continually update what does it mean to be me right now, and then tomorrow something new is piled onto that, and so I got to figure it out again. And so when we're dreaming, we're in that state, and whereas autobiographical memory is basically it's more of a narrative than it is a retrieval process. But I haven't talked much about that with you guys, but I'd love to hear your thoughts on memory. But I think memory is so inextricably tied to the ego.
Oh yeah, yeah.
Right, because it's like if I don't have that, then my ego is almost completely gone. And so things that affect memory, you don't normally think of it because we got this stupid computer metaphor that everybody thinks about. Like, oh, memory is retrieval of data banks, and no, the brain doesn't work like that. Instead, it's this continually updating narrative that I'm cooking up, and it's more or less accurate enough to get me going. All right. So that's how memory, but then dreams come in and say, okay, that's what happened. Now, what does it mean? So I create a picture and images of what it means in emotional terms. Well, if all of that stuff is scrambled up, then I have psychosis, fragmentation, so forth, and that's why it impairs memory as well as causes this thought disorders and all that. But when you guys are working on folks in hypnotic states, you're able to actually help them pull together memories that weren't retrievable initially. Isn't that right?
Yeah, that's a really good point. Thank you, Dr. Goodwin. When we consider what the neuropsychoanalysts are doing and how much they follow cognitive neuroscience with respect to memory consolidation, and how we can go so far with them, but a lot of what they say doesn't seem to match the observations that we have with respect to declarative and non-declarative memories, for example. We are very, very careful about recovered memory in a constructive sense of things that did not happen. So we're not looking for that. The way that we utilize it, if we use a very focused hypnotic method, and we do use lots of different techniques, non-hypnosis ones in the ordinary sense, would be that we would generate a reflexive experience of the ego, which is separate to the ego's normal state. So it's, if you like, a controlled neurotic division, a split, neurosis being obviously just meaning a split in that sense, where it can observe those complexes that are normally associated to its autobiographical self-concept and disidentify with them by seeing them at a distance from itself. And that's very similar to an Eastern meditative technique. And it's as far as a lot of Eastern methods will go. But what we try to do then is to move them through different phase states of consciousness. So in effect, they're going back in an evolutionary sense, away from the prefrontal lobe, cognitive in that ordinary sense, way that the ego understands itself and its immediate experiences, back into an affective state of consciousness. And we make a distinction there from the Jungians too, where they talk about emotionally toned ideas. Now for us, an emotionally toned idea is still a cognition, whereas a pure affect tends, when it's experienced, to be the kind of thing that you were talking about earlier as an image which represents an entire situation. And the referential point, the ego itself, feels itself in relationship to the image of the context and feels content with that. This is something I understand, and it's not cognition, it's affective. And we have this other principle to support this, which is that affect is, this kind of affect is the carrier wave of instinct. So if we can ride the carrier wave back in a dissociated way from the complexes which are associated to the ego, in other words, the normal Geneian ones that form whenever there's a division or a partition, then we can head back into the psyche and start to experience it in its own terms. So what Jungians regard as archetypes, we would regard as meta-instinctive scenarios, which are latent and form themselves into deep structure representations as the ego moves towards them. So they would configure in real time, because this is the immediate phenomenological experience you have when you go in, they would configure in real time dialectically to meet the approach of the ego. And provided the approach of the ego is safe and secure, then they will meet something that is likely to inform them about what they need to know and to do. However, if the ego goes in without separating itself from its normally associated complexes by the usual methods of introspection, it's quite likely that a particular kind of psychodynamic would intrude, which we refer to as being internal projection. So the ego projects internally rather than externally those things that it has learned about, and we could say are complexes based on that learning. So, for example, a Freudian might see the id, literally experience the id, but only as a mirage which is projected inward from the ego in terms of its expectation of what's there. A Jungian might see the shadow or the anima, because that person's been told that such things exist and that this is the construct that you experience.
So someone who maybe was raised in a culture thousands of years ago, or maybe like a hunter-gatherer society that has an animistic sort of belief system, they wouldn't see the anima and the id and the ego and all that stuff. They would see the ancestors or demons or nature spirits or whatever.
Yeah, and probably behind that, because there'd be some elements of that that would still be cultural transmission. Behind that, they would probably get because this is what happens when you do it. This is my own experience and experiences of you and people that we work with, is that they get an entire scenario presented as a context, and they feel a sympathetic resonance with that is so deeply ancestral, it moves them out of their personal ego frame and into connectedness with what is probably a projection out from the genome with its own intentionality.
Okay. So you're talking about an encounter between the ego and the genome, essentially.
Yeah, in a representational form.
Right. Non-verbal, right? It's all,
yes.
You just sort of, you grok what's happening, right? It's not words and cognition.
Non-cognitive, isn't it?
Categories and all that sort of stuff, right? That's downstream from what you're talking about, because the process, and correct me if I'm wrong here, but it sounds like you pull them into a state where that stuff is toned down.
Yes.
That all that cognitive stuff and the boundaries of the ego and the self are also kind of made more porous.
Yeah.
You could say.
Yes.
And so then you are encountering this more raw upsurgence.
Yeah.
That is, it can still kind of get processed and then projected to a degree.
Yeah.
But if you're on guard for that, you can see it.
You can see it. Yeah. And we have a term for what you're likely to experience at first. And this is something which I would point to Tantric Buddhism as being a confirmation of that, because they have a different sort of model, but it produces the same thing. In other words, the ego will ultimately see something which has been configured from within to match itself. And at this point, it's no longer internal projection from the ego, it's a projection from deeply within towards the ego, which allows a lock and key to form. And we would refer to that as a deep structure complex, which is essentially Janus faced. So the superficial surface that meets the approach of the ego is configured to receive it, but on the obverse side is the true context. And the reason this seems to work is that that's a kind of homeostatic configuration that otherwise would be too bizarre. We wouldn't be able to, there'd be a gap problem. We wouldn't be able to cross the gap from the ego leaving its attachments, as say the Buddhists would understand, so its fictions, in other words, its complexes, and then what is really within. The Tantric Buddhists would refer to Bodhisattva as being the place that we're trying to get to, the enlightened mind, the self, the Jungian self. But the projection of that allows us to see what we've done to ourselves. So it would be, a Jungian would probably see the Jungian self archetype in a reified, personified form, but we would say that's only a representation and is not the thing in and of itself. It may be a geometric image, it may be a mandala, but these are things which we learn about rather than spontaneously emerge very often. So I'd want to know what's on the other side of that. That's the welcoming image, but it's still not the destination, it's not the goal.
Right, because the map is not the territory.
Yeah.
Right. So I'm seeing the image, and that's the best thing, as Jung would say, I guess, is that the symbol is the best way that it can express. And you and I remember talking about this piece of it in Neurobiology of the Gods, where the use of metaphor and symbol in cognitive linguistics, they would talk about how we use metaphor and symbol all the time in our everyday language, but we don't normally see it. But when we're getting into these kind of metaphors, they're so pre-verbal, whatever you have to say. They represent a ton of meaning, but it's not much that you can, they're ineffable, right? There's a core of ineffable meaning to them. And it's still, at the end of the day, a symbol, but of what, right? That's what we're trying to get at, right?
Yeah, yes. And the symbols, I think this is a problem for some Jungians, is that they are too cognitive. And the example I would give about that is the process of amplification in dreams, for example, where you get a so-called dream symbol presented, which would require unpacking in and of itself, which the Jungian then amplifies by providing another correlation or example of, which really just duplicates the problem. And I would argue that what we're doing there is generating more and more surface structure variants of the thing that we haven't understood. So we can amplify away, and it's obviously well known that with Jungians they can make this mistake, is that they project their model into the experience of the patient.
Right. They try not to do that, but it's a known risk.
Yeah, I think with amplification it almost inevitably happens. And then you get this shared field phenomenon between the two, where there's a waveform. It's part of the transference as they would understand it, and the countertransference. But you're moving away, and Jung did say don't move away from the dream, but at the same time he says amplify.
Stick to the image.
Yes, but at the same time amplify it. Whereas we would say that the task really is for the symbol to unpack itself, but to unpack into the ego might not be possible. The bandwidth, the carrying capacity of the ego is far too compressed for that. So it's probably better if the symbol announces that it exists and then unpacks, and I'll use a Freudian term here, pre-consciously, or Genean subconsciously.
Right.
It was updated homeostatically from within. And that would leave the ego free to do its normal job, which we always suggest to people, is that you turn the ego around and look out. You've evolved to look out, not to look in.
Yeah.
And under ideal conditions of homeostasis, the so-called unconscious will self-regulate. If it doesn't, then that's not good, but it's not necessarily the ego's job to tackle that. if the ego is adapting to the outside world, generally speaking, the unconscious will turn over in its own way. But what we're saying is, if we do something abnormal, which is to go in and try and find out what is the inner world like under its own conditions, we have to be able to dissociate from our own learning and experience. And as you say, that includes linguistic and cognitive models of whatever that might be. And that's a feeling. And at that point, we're in a Paleolithic ego state, which is probably an affect level of consciousness before cognition ever evolved. So we're
right.
It's like,
so even like before Paleolithic, even like proto-hominid.
Yeah.
Yeah. So one of the things that I've noticed in psychotic patients is that if you, and this, you'll get this from any, I think most psychiatrists that work with psychotic patients any amount, is that you have to kind of learn what they call schizophrenies. That was one of my supervisors called it that, where you hear the psychotic stuff, the material that they give you, but then if you understand this enough, you can kind of get at what's really going on that they can't express because of their state. And the way I handle that piece and translate it is to remember that, again, because I think they have a problem integrating information, that what they're getting are symbols and metaphors, but they can't take it as such. They take it literally. So, for example, I might have a patient to come in and say he complains that his whole family has been eaten by cannibals, right? And they're all dead. So I would listen to that and think, I wonder if there's an underlying metaphor here that he's effectively expressing, that the unconscious is producing to represent the situation that he's in, but that the psychosis is keeping him from being able to understand that that's not a literal state, it's a metaphorical state. And then as they get better, I can confirm that assumption or interpretation by kind of looking back and saying, I remember when you first came in, you said this, what did you mean by that? And if I get a coherent answer out of that, because sometimes it's like, oh, I never said that, I'll get that. But sometimes I'll get, well, we've not been getting along, they're dead to me.
Yeah.
And it's like, aha, there it is. There it is. So they had that thought, as it were. It's not a thought as we normally think of, but it's a metaphor or expression.
Yeah.
And this way of looking at it comes from studies that I remember looking at years ago that compare psychosis to the dream state. So it's kind of an uncontrolled waking dream state when you're psychotic. So that kind of maybe reflects into what you're talking about when you put someone in a controlled state like that. It's way more controlled than psychosis is, of course.
Yeah.
But they're still, you've reduced the boundary enough to where they can see the images popping up from the genome, whatever they are, right? And they're not so impaired that they take it literally, hopefully.
Exactly. Yeah.
Right.
We would try and make sure that the ego boundary was secure. And one of the ways of doing that is to make it progressive. So first of all, they separate in a non-attached way. And I'm using Buddhist terms here because I think they actually know what they're doing when they do this. Non-attachment is hugely important. The typical Jungian style complexes that form most of the ones that are Jungian in nature, they require attachment to the ego to persist because they're continually being reinforced by identification, the part of the self-concept. Of course, in a dream, the dream ego and the waking ego share the self-concept.
Right.
So the ego-identified complexes are pulled into the dream with the ego, and they are represented in the dream narrative in that way. Yeah,
I remember you saying that it's as if they were orbiting the ego like a planets. Yeah. That's one way of thinking of it. But because it's largely ego driven and like experientially driven that those things emerge. They're not so much innate.
Yeah, it's the identification is the problem. So in a tantric Buddhist opus, I'll call it that, then the first thing that you encounter are what they call wrathful deities, but you're told they're not real because they are fictions created by the state of your own mind. And I say that equals or equates to internal projection. Then you find the peaceful deities, and that's when the affect comes in, the positive affect, because you know you're safe and you know that these are not real. And that is ego strengthening, or it's at least a definition of ego strength, to be able to separate from the fear of seeing these awful things. That the Jungian might say that's the shadow, or a Freudian might say that's your id impulses. The Tantric the Buddhist, though, would say that's a fiction generated by you. It's not real. It's reflecting back how you're treating it. Your approach is completely wrong, and you need to separate from it. So I see a correlation there, in the same way that when Jungians say there are correlations between myths, between different cultures, I'm seeing an exact, pretty much correlation between that and this kind of method, where you detach from identification and you can move very rapidly into a new state of relationship to the psyche on its own terms without projections. And the return journey is very interesting, because when you come back, there's very often a spike of affect, which is the transpersonal, as I understand Jungians to mean it. And that actually protects you as you move back into normal ego cognition, because it pushes complexes away. And as the ego tries to reconstitute itself, status quo ante, to the dissociation, the complexes will naturally try and reassociate, but the positive affect spike pushes them away. The problem then is that we've been in a dissociative state, and we have to reassociate. So it then becomes a cognitive issue. This is when cognition comes online. I have to make a cognitive model of my experience, which excludes the complexes, but includes the experience, so I can associate it continuously to my normal ego. Otherwise, it's state bound, and I have to go back in again. And that can be a problem, say, if people use substances, LSD and so forth. They think, I can only get in that state again if I'm in that state, because the integration, which is ultimately cognitive, hasn't occurred for them.
So you're basically utilizing the psyche's natural ability to dissociate in a highly controlled and very focused manner.
Yeah.
Whereas a lot of what we see in folks with like severe trauma, or again with psychosis, is that capacity running amok.
Yeah.
So like a trauma or drugs or whatever comes in and fractures and creates all these splits. But it's not controlled. There's affect all over the map, and there's the ego is completely disorganized and disheveled.
Forgive me for interrupting. I think that's a really good point, because again, the Jungians seem to think that the ideas in what they model as being complexes are held together by a common emotional tone, which you can detect using word association and the psychophysiological testing. That's fine.
Right.
They've missed the real dynamic, and that is that the affect, being very old and long in terms of its evolutionary perspective and bandwidth, is capable autonomously of associating ideas to itself. So the affect then is more important than the idea, which people don't like, but I would argue that, and this is why I would argue, if we take an evolutionary model, then the problem we have now is when affect intrudes in an uncontrollable way into the ego and cognition is disturbed. That's what we seem to experience. But cognition as we use it now is new, relatively speaking, and it's limited in its processing capacity. If we wind back to the Paleolithic period, when cognition was coming online in an evolutionary sense, the intrusion would have been the reverse. The instinctive affect relationship to the world, externally and internally, as one continuous form of consciousness, would be disturbed by these new thoughts. What are they? And now we're disturbed by affect. What is that? And for a while then, we could say perhaps a kind of psychotic episode for a Paleolithic human would have been when thoughts were intruding into the stability that had been provided by hundreds of thousands of years of adaptation to affect as being the primary confirming form of consciousness. And then this virtual modeling was turning up with all these possibilities that are not in the senses, and that are not in affect and not in instinct. It's a virtual thing. This could happen, that could happen.
Yeah.
That would generate a reverse kind of psychosis then.
Yeah, that's a great way of looking at it. It helps us to see how all the cognitions can tangle up the system.
Yeah.
You know, and definitely you can see this. I think this is why people kind of naturally gravitate towards CBT, because the central theory behind CBT is that your thoughts are what's screwing you up.
Yeah.
The problem is when they say that the solution is to restructure your thoughts, but that doesn't really work. It doesn't quite work.
Yeah.
It may temporarily help you, but then you're just kind of back in the same boat, you know, a couple months later. But yeah, and the idea of being able to create all these virtual scenarios, and then the affects are responding to those. They're saying, yes, oh, all this catastrophizing could potentially, well, why wouldn't I be anxious about that, right? So that's why I would say when I'm teaching is that the emotions are actually rational.
Yeah.
It's the perception and the cognition and the whole like framework of the world that you've cooked up in your head is what's causing all the problems. So it makes sense to me that the stuff that you're talking about, that you've kind of brought in from Buddhism and all that, where you detach from all of that and say no mind, right?
Yeah.
Let's set that aside and bracket it for a minute. I think would certainly help to sidestep all of that wackiness and give you a perspective from the outside. I've noticed too that in myself and some patients, when they're kind of gravitating towards a state like this, they'll a lot of times will have dreams of seeing themselves walking around doing things, but you know, like the perspective of the dream is sort of like the POV of the dream is sort of free floating, right? Not attached to anything.
Yeah.
And I think the classical interpretation of that would be, oh no, they're dissociated. That's bad, right? Watch out. Yeah. But I don't think that's necessarily always going to be like that. It could also be that they're having a different point of view and seeing themselves from the outside, which way you're describing is a way of healing. Can be.
It's inclined towards what the genome has anticipated for so long that it's as if it's still getting used to being able to think, but it's very used to being able to feel. And the neuropsychoanalysts, they've done great work on Panksepian, as they're known, instincts and drives, but it's as if they moved from that directly to cognition. And I think they're missing out the middle bit. And this is where Jung's model of archetypes, although we do reframe that, we talk about meta instincts comes into play, because Panksepian instincts without a context will fire randomly, and they'll fire under great pressure. And you see this with people who are in terrible anxiety states or with phobias, that the instinctive drive to do something or to overcome a problem is there, but there's no proper scenario for that to be worked out. So they end up in a drive state, and then some psychologists mistake the drive state for being of anxiety for being an emotion, and we would say no, that's the wrong focus. We honestly think that anxiety is a drive state, which is analogous to libido, which means something is releasing that drive state. And what you need is a context, and then the drive state calms down, because Panksep aligns itself. The context is archetypal or meta-instinctive, however we want to frame that. So we look for the meta-instincts to provide the scenario for Panksep so that the drive state is appropriately distributed, and then cognition does what it does best and is orientated outwardly towards future goals, possibilities, and that the instinct settles down because it feels content with itself.
Yeah, and that makes sense too if you look at the history of Homo sapiens and how rapidly the brain changed. We're still in a state of sorting that out. I mean, if you look at humans, and humans don't change, let's assume, in 5 million years, it might be that brains have gotten that better figured out, and they don't necessarily do that as much. But the advantage of all this cognition was just so tremendous that it just pushed in that direction. And the rest of the genome hasn't had a chance to really catch up with that necessarily. Yeah. Because it's so rapid, like it's so recent.
Yes.
In geological terms, anyway.
Absolutely.
Yeah.
To add to that.
Anything specific you're thinking of?
Well, I was thinking about the way that meta instincts, in our experience, are informational systems, aren't they? Insofar as they represent, and it's so close to Jung's idea of the archetype itself being virtual without definite form. There's a sufficient form there. So a Paleolithic instinct can adapt to contemporary New York City.
Yeah.
Enough. So we don't have to become Paleolithic. We just have to have a correspondence between the two sufficiently for instincts to work properly, and then for cognition to be freed up. And
yeah, right. Because all that's to say nothing of the fact that that our world in the last 10,000 years looks so different from the world of the previous 190,000 years.
Yeah.
Of the existence of humans.
Yeah.
Even just looking at the history of human migration patterns, for example, like there were only humans in Africa for 140,000 years of our existence.
Yeah.
It's only 65,000 years ago that we saw humans even leaving Africa and so the diversity, genetic diversity in Africa is much larger than the rest of the world combined.
Yeah.
Because of that just deep time. So we're still trying to figure it out. We're just sorting it out.
Yeah.
So let me back up for a second. I've got a new paper coming out in the Journal of Analytical Psychology where I'm discussing the biological theory of archetypes with Professor Christian Russler. And he and I agree on a lot, but we strongly disagree on the biological dimension. And I'm sure you can tell who's on what side. And so I start off with a dream that he presents in one of his books. And I wanted to see what you thought of how you would frame this dream. So the patient that he presents is a guy who has stagnated. He's got severe depression. He's been just kind of staying in his parents' house. Both of his parents died. And he's just got no motivation. His mood is just down in the dumps. And it's been like this for a long time. Gets into therapy, starts working with Dr. Russler. And he has this interesting dream. And Russler uses this dream as a springboard on a discussion of archetypes. And then I kind of come in and make commentary on it. But the dream is that he is suddenly surrounded by these people that are like dressed up in like a tribal uniform or outfits, like body paint and all this. And they grab him and they drag him off into the forest and they bring him up to this big stone circle that it's like a hole in a stone, and they drag him through this hole and it's very painful. But then when they pull him out on the other side, they lift him up and they celebrate and they say he's now part of the tribe.
Yeah.
Okay. So obviously he goes from that to a discussion about initiation dreams and you know, usual Jungian thing of amplifying initiation rituals and all that. And that makes perfect sense to me. But how would you frame that in this way of looking at things that you've been describing to me?
Well, Paul, you and I would want the context. We have a saying, which is simple enough, but there's a lot to unpack in it, which is that the ground always betrays the figure, which is the reverse of saying figure ground. So if we know the context, then the context will reveal fully what the figure is. And a dream like that is going to be, I would believe, is going to be very closely associated with personal experience that person has had or influences. So that's still in the figure. I don't know the ground. In other words, what informed the representation of the ground into that symbolic focus for the figure. So I would accept it because it's said, but I wouldn't stop there personally. We wouldn't, would we? No.
Well, no, we wouldn't. I think it would.
What would you do with it?
Right. Well, I think it would be easy to just, given like yourself, Dr. Goodman, that we have something of a Jungian background, to immediately think of it as being some kind of initiation dream and a symbolic rebirth. But again, I think, as Steve is suggesting, if we were to stop there, and it isn't specific enough for that person's individual context, then immediately we've lost rapport with that person. We've lost an opportunity to understand their context properly. And so we probably do a number of things. Like you say, Steve, we wouldn't stop there, but we would maybe, through something like hypnosis or working with creative media, or through some other intervention, do our best to see how else that information might be represented to us, so that we could come at it from another angle. Because the problem with any amplification really is that there's always the temptation for a start to for your own stuff to come through and to get mixed up with that. And it's so easy to get it wrong. And then if you do get it wrong, I think, like what Steve was saying earlier, how you then end up having to approach the unconscious again, and to gain its cooperation and to look for more representation. So you're increasing the complexity of what you're doing, essentially, rather than getting back to what it means for that individual person in their given context. So you're moving further and further away from being accurate in your interpretation, rather than getting closer to the true meaning.
Well, that's I think Jung had an intuitive understanding of that problem and that comes through, but it only really comes through in his seminar transcripts, if you've read those. Because then you hear him kind of from the hip, where he's just shooting like, this is how I do my thing. When he's theorizing on it, though, it seems as though it's a whole lot more concrete and kind of almost cookbook.
Yes.
You know, you get this content and then you run it through this machine and out pops the interpretation.
Yes.
But I don't get, and that certainly people do that, unfortunately, because that's a mistake in my opinion too.
Yeah.
But when you read, like, how does he do it? Like, he'll say things like, I want you to study world symbolism and then throw it all out the window when you walk in with your patient, right? So like, how do you make sense of what does that even mean? And I think it means recognize what it could be, but don't stick that on there until you're absolutely sure, right? And then sometimes you can make kind of tests, interpretations, and see if it sticks or it doesn't, and that kind of thing. So what I would do with this is, I think it's similar to what you're suggesting, because I would do things like, tell me more about what they look like. Tell me more about what it felt like to be in there. I'm not telling him, oh, this is an initiation ritual. It says you need to transform yourself. I mean, what is that going to do? Right? That's going to alienate them. They're going to be like, what are you talking about? So I don't have to go there with them and get all theoretical. Instead, maybe draw a picture of it, or write a story about it, or something like that. Like, is that what you mean, or are you talking about something different?
Yes, absolutely, because that's changing the representational form, and then immediately you have another angle on things, and you can work with that material in a different way. So I think absolutely that's the thing to do.
Yeah. You're inviting a response.
You are, a naturalistic one from the unconscious, as opposed to one in which you interpret something and then you impose that interpretation onto the unconscious. I think that's always a mistake. I've run into folks who had a Jung-oriented approach, and they were disappointed by what they felt was this kind of just knee-jerk. Okay, this is what this is. This is the anima. This is the self. This is the blah, blah, blah. Yeah. And of course, now Rusler, that's part of what he's targeting, is that stuff, right? So I agree with him on that. Like, we shouldn't be doing that kind of thing. But then he goes too far, in my opinion, anyway, and says that we don't need biology. We can just study cultural studies and forget about biology. Oh,
And I
dear.
think
Yeah.
that's bonkers to me, you know.
Yes.
I'm like, well, no.
We're on the
And
same
nobody said
page.
throwing away the
Yes.
cultural material is a good.
Oh.
I would never say that.
Yes. Yes. Yeah. I mean, it's ridiculous, isn't it?
Yeah.
I mean, I'm kind of looking at that myself at the moment in a completely different context, because I'm kind of charting the history of feminism, and it's with respect to sort of the surface structure in interpretation of it. It's a very, very complicated field, but what you find out very quickly is that there's nearly always a correlation between what's happening biologically and how that biology is being expressed culturally in whatever form, and the two things run hand in hand, and that's it. There's no escaping that. You can see the correlations. So, for example, you can see peaks and troughs, say in birth rates, correlated with the kind of metaphors and the kind of cultural representations that turn up that actually maybe encourage us to do something about increasing the birth rate, for example. So you might get something like an increased sort of genre of films, say Disney films, which are sort of very romantically based, as if the genome understands, it has this sentience, and it picks up the fact that there needs to be some reconfiguring, shall we say, of traditional roles in such a way that we can then put the birth rate and the population rate back up. And there is definitely a correlation between the two. It's not difficult to chart it. So that's just an example, really, of how important biology is. And
I've got a couple of others that just popped to mind. If you look cross-culturally at the male to female ratios within a subpopulation, that correlates with sexual mores. If there's lots of men around, then because then that makes women more relatively higher in demand, then the sexual mores surround long-term commitments and not sleeping around and all that sort of thing. Right. And in the opposite situation, when there's not enough men around, it flips around, and all of a sudden it's loosey-goosey and let's go wild. Right. And so so then that's interesting. And like you say, there's a biological contributor to that, surely.
There is.
And anyone who's skeptical of that, I would say, well, hold on, let's look at other animals. And coyotes, for example, in the wild, when there is a reduction in coyote population, I mean, somehow they know, and they have more coyotes. They're having more coyotes. Like, I don't know how they know this. Did they get together in a committee and say, we need to have more pups? My wife and I were talking about this, and she said maybe it's pheromones. I don't know, or just it could be something simple like the number of times I encounter another coyote. The genome tracks that. If it's above a certain number, okay, then we don't need to have as many. If it's below that number over a certain period of time to get busy. And so all of that kind of stuff, it's any number of those things could potentially be on the human genome, but we wouldn't necessarily notice it because, one, it's extremely difficult to study with precision. And two, we don't want to believe that we're affected by that kind of stuff.
Well, that's true. Yes.
We like to pretend like we cook up our own whole world and it's all cognitively the exact way we want it. And no,
clearly not the case. Oh, we're with you all the way on that.
Oh yeah, definitely. And just oddly enough, James has put together a video, hasn't gone out yet, where he asks us about two dreams. It's kind of a supervision thing, really. With one of his clients, and it's a few months ago, and I'd more or less forgotten about it, actually. I mean, we gave a response in the seminar setting to it, and then he came back with a reported dream from this patient he was working with, and it had responded, the psyche had responded in its own time, and that was, I think, on Sunday, or was it last week, when and he's seen this person again and communicate, and already it's moved on. It's like the impetus is increasing from the unconscious, which is something that we see a lot, is that if you make a provisional interpretation and are completely open about it and say that I don't know, I'd like to know more, generally you get a response that's collaborative, and what Jung talked about, a compensation, not just for the conscious attitude, but for the therapist's attitude. Whereas if the therapist just sails off on amplification after amplification, it'll disengage. And then the analysis takes years. And it may have only needed a few weeks. And I know that's controversial. But the solution emerges when it's as if the psyche can take not only the ego, but the therapist seriously enough to how you can be updated. And then the imagery changes and it moves with you, but adds a bit more. And it's fascinating because you know you have rapport then, and it's not this internal projection phenomenon that you get when an ego that's been educated thinks it can interpret the unconscious. It's a receiving of what you're given. It's very different, isn't it?
Well, it's very different because I hate to say this, but it tends to be academics who by and large think that way, whereas someone like yourself, Eric, who is
academic, but he's more
but he yes, of course, but it also a practicing clinician, and you seeing these kinds of things in the raw day in, day out, it makes a huge difference to how you think about things and how you practice. It really, really does. Otherwise, it just remains an idea or a set of ideas. But it's when you're at the sharp end of things, it's very, very different. And
that's what we get when those of us in the trenches, right?
Yes, well, you are.
You are
absolutely, you are. And maybe I shouldn't say this, but I will. I think you should emphasize that more. Really, because obviously you do a lot of this kind of thing on Zoom with academics who have no clinical experience. And I think what stands out with you is the fact that not only are you academic and very, very well educated, but you are a clinician. And the example that you gave of the patient and the cannibalism, I think was so interesting. It was the high point of the whole thing, wasn't it? Because that insight, you could do so much with that, and I'm sure you have, and I'm sure you've helped that person massively. But without that, it's dry. For me, it's dry, it's dead in the water, it's not going anywhere. They're just ideas. But that's that was like the high point of that particular discussion for us, wasn't it?
Awesome.
So
awesome. I have to go, but
bless you. Okay.
Yes.
Thank you so much.
Wonderful talk.
Yeah, we'll hopefully be able to do some more.
Be lovely.
Yes.
Really
thank you.
Thank you.
Thank you.
Blessings.
Take
Bye.
care.
Thank you. Bye now.